Over 154 million prescriptions for antibiotics are written in the U.S. each year, with many of them potentially saving lives. But in recent years, one of the most commonly prescribed groups of antibiotics has come under fire with claims people have suffered sometimes catastrophic injury after taking them. Fluoroquinolones are a class of antibiotics that have been prescribed for years to treat everything from sinus infections to septic shock. But now some doctors are concluding that they should only be used in very specific situations. They say patients are suffering from nerve damage, irregular heartbeats, depression, and seizures because of the medication. The Food and Drug Administration is currently advising against using these antibiotics, except as a last resort, but the drugs are still commonly prescribed for minor infections. So how can you protect yourself and your family from the dangerous side effects of antibiotics? So when it comes to this class of medication referred to as fluoroquinolones, there is a black box warning, which is really telling physicians, everyone else, pharmacists, patients, look, there is potential here for severe adverse reactions as opposed to the typical reactions where, you all have seen the list. But in this case, the risks were with tendinitis or potential tendon rupture, peripheral neuropathy, CNS, which are central nervous system effects, seizures. Now, the good news is lots of these antibiotics have been prescribed, and the great majority of people do just fine. But the concern is that old habits die hard. Mm-hmm. For maybe a very simple upper respiratory infection that may not even need antibiotics at all, these are still commonly prescribed.
And that's where maybe as physicians, we need to do better.
Yeah.
That, think outside the box. We have a list of what is your first go-to drug for a given condition. Maybe we should rethink this and not immediately go to the quinolones as a first choice drug. I've prescribed them for years. I've taken them myself on numerous occasions. I have felt some tendon and musculoskeletal irritation, and my doctor warned me that, and I backed off and stopped, and they went away.
And I think generally speaking, it just makes me think about when antibiotics should be prescribed. And I think there is definitely a place for antibiotics, and in a lot of cases where you go to the doctor, they say you need this antibiotic, it's because they've weighed the risk and the benefits. But sometimes I think patients will go into a doctor's office with a virus, and you don't treat a virus with an antibiotic, and they will become very upset if the doctor does not prescribe an antibiotic. So just realize that once again, there is a place for antibiotics, and even these antibiotics can be appropriate in particular situations. But sometimes your doctor is kind of trying to protect you from yourself, because if you don't, even if it's a mild side effect like nausea or vomiting, we don't want you to have that either if you don't need it. And if you don't need an antibiotic, we think about antibiotic resistance.
Although I would argue there are a lot of healthcare providers out there that don't think about benefits versus risks. They forget that there are risks with antibiotics. There are a lot of people with heavy pens out there. And it's because it's really easy to get 5 stars from a patient when you just give them what they want. And then this has been an increasingly frustrating time for me, because despite all the new data, I still hear patients frustrated when they say, oh, you know what? My doctor or my nurse practitioner or my physician's assistant told me I didn't need antibiotics right now. And there's this sense of frustration. Just remember that when that happens, that encounter, that may be to protect you, because the conditions these antibiotics are prescribed for, there's pretty good data in many of these cases, like a simple sinusitis. Antibiotics aren't needed.
Well, and these are probably the biggest instances where antibiotics are being prescribed. Somebody has an upper respiratory tract infection. The doctor go, well, you may have sinusitis too. Boom, put them on antibiotics.
Just take this to be safe.
Right, and in most cases, probably the common cold.
Right, and the problem is your body builds up a resistance. So when you get another infection, we can't give you this antibiotic anymore because your body doesn't care about it. Like it's able to just go ahead and proceed with the infection. So we have to give you something stronger. So we're trying to protect you from that particular situation.
And the takeaway here is that antibiotics absolutely in scenarios absolutely can be life-saving.
Yes.
Still very important in the treatment of bacterial infections. But as a consumer of healthcare, as a patient, Every time you get an antibiotic prescription, you just ask your healthcare provider, okay, is this the best choice? What exactly are we treating here? And if the answer is, I'm not really sure, let's talk a little more here then. Let's figure out what we're trying to treat.